I'm part of the 136 Family Educator program, and I have been part of this program as a parent of a deaf child. My son, Indigo Muller, was born profoundly deaf. I recognize as a parent of a deaf child just the importance of those milestones, which are 136, with the 1 month being rescreened, 3 months official diagnosis, and 6 months a child should be enrolled into early intervention. And by meeting those milestones, it's really critical for language and child development. We're also asking audiologists a series of quick questions just to get a sense of what type of equipment they're using, and also sharing with them resources that the state has now developed, as well as the Center for Family Involvement, to share with families when a diagnosis is given.
And I'm Cynthia Clark. Nice to meet you.
Nice to meet you. So the state of Virginia does an amazing job of screening newborns, but what we're finding is that those babies that fail specifically are not being rescreened. For whatever reason, parents are not feeling that it's necessary, or they're missing appointments. We're not really sure, and then we don't see those children until the kindergarten. I'm just going to ask you a series of questions. We're gathering data from audiologists all over the state, and we're reporting back and just trying to come up with different processes and systems that may push parents to get their babies rescreened. So approximately how many infants are tested each month?
So I think we test somewhere between about 30 and 40, but that is a mixture of babies who have not passed their initial hearing screening and babies who have passed but are considered at risk for hearing loss because of extended NICU stay, other NICU risk factors, family history of hearing loss, something like that.
Okay. And how many audiologists see infants specifically?
There's 4 of us in the clinic who do, and then 1 other audiologist who does sometimes, but she does mostly sedated
Would
hearing
I be able
testing.
to get those names? Like
Yeah.
we can email
Yeah,
correspondence,
absolutely.
and I would like to know names. Can you think of any other important contacts that we should know about regarding maybe anyone who enters data or anything like that into our visits, that we should also have their names?
I do all the all the data entries. That's
Gotcha.
me. You've
All right.
got it.
All right. So now I just have an audiologist survey that I'm going to go through. Mm-hmm. And so you do rescreens here at UVA.
We actually do all diagnostic testing, so we don't do any rescreening. It's all diagnostic.
Oh. Diagnostic.
I don't know if that's important.
Yeah,
in the rescreen
because
versus diagnostic, but we only do diagnostics.
So what equipment do you use for diagnostics?
We use the biologic for ABR testing, and then Cordy for OAE testing.
And since you do strictly diagnostic, do you allow time for that? So you do diagnostic on that event when the baby makes that appointment.
And so all of the appointments are set for an hour. If we have a situation where we have concern for hearing loss, like maybe they were seen at another center and they think that maybe there is some hearing loss, sometimes we'll try to set aside 2 hours just in case, so we make sure we have plenty of time to do all the testing that we need to. Also, babies have to be asleep for ABR testing, so sometimes we'll allot a little bit of extra time if it's an older baby, or if we've seen the baby here before and they didn't sleep at all, sometimes we'll allot a little bit of extra time if we can for subsequent appointments, just to make sure we can get all the data we can in an appropriate amount of time.
Okay. And who sets up that appointment? Is that done mostly through families, or does the hospital?
A lot of times the hospital will set it up for the NICU babies, and then sometimes the babies discharged from the well baby nursery, they'll help them to set it up or provide them with contact information for our clinic. A lot of it's done by the pediatrician too.
Now, when someone calls here to make that appointment, do they ask if the baby has failed the screening?
Yes.
All right. So now I'm going to ask you some questions about the follow-up process. Okay. Who enters the audiological report into visits?
I do.
And are you registered with Eddie Pals?
Yes. We are.
So I have lots of resources
Yeah.
here, and so we're going to kind of touch base on a little bit of these. And then, have you seen this brochure, Communicate with Your Baby? Do you
Yeah.
guys use it?
We have it, and we try to provide it to babies who've been diagnosed with hearing loss because it's got a lot of good information in there. We actually haven't had very many recently diagnosed with hearing loss. We also there's a brochure from ASHA that has some speech and hearing milestones on it that we try to provide to
Could I get a copy?
families.
of
Yeah,
that?
absolutely. It's especially helpful, I think, for first-time parents who maybe
Okay,
don't know what their
yes.
baby should be doing
Well-
at each age. Because they're like, well, they're 3 weeks old and they don't turn to their name when we call them. I'm like, well, that's okay.
Yes, yes. I mean, you
Nothing
should
to
know
worry
when my
about.
son failed, the nurse came back with this one-page handout, and it was awful. And so now the state has developed a lot more resources for families.
Yeah.
And I'm going to go over a little bit of those as we continue. Do you specifically mention anything on the? So this is a national publication, but on the inside there's specifically to Virginia.
Yeah.
Okay, so you do mention. You talked about the ASHA handout. Are you aware of the Virginia Hearing Aid Loan Bank?
Yes.
Okay. And I do have some brochures here for you. I personally have used it because my son was profoundly deaf. We didn't have to buy hearing aids. We got them from the loan bank to go through the FDA trial of 3 months, which saved us a great deal
Yeah.
of money. And then I still use it for the Soundfield system. We borrow one for his school. So I will leave you a few of those.
Wonderful. Thank you.
How do you support those families who don't use English as their primary language?
We do have a couple pamphlets that are in Spanish. So we have that available. Other languages, we don't have
Okay.
anything readily available in the clinic.
Do you have an interpreter on site?
We do have interpreters that come
Okay.
to the appointments, but as far as handouts go, we don't
okay.
necessarily have anything. But we do have interpreters. If there
appointments,
isn't
okay.
a live interpreter for appointments, we have the Siricom phones
Okay.
that are interpreted, that you can call the number and pick a number of languages. So those come in handy when we don't have a live interpreter.
Awesome. All right, so I'm just going to kind of go through, touch base on each one of these. We've gone over the Communicate with Your Baby, and I will leave you a few extra copies.
Wonderful, thank
and
you.
if any of these resources you need more of, you can simply reach out to me, and I can
Okay.
get them for you. So the Communicate with Your Baby, Family to Family Network, and so that's part of the Center for Family Involvement, and I'm also part of that. So if you have a parent who wants to talk to other parents, I know for me, I could not get enough. Anyone who was willing to listen and talk to me, I wanted to talk to them. So there's a phone number on the back, and this is their main number, but you will be connected. So, and it's related to our journey. So if you had a family that was interested in cochlear implants or something like that, they might be able to talk to me. There's 5 others, parents who are involved in this program who all have different experiences.
Okay.
So they would put you in touch with the family that is best suited. We have American Sign Language resources here in Virginia. So this is just a resource guide for families that might be interested in American Sign Language. So I'll leave you with some of those brochures. I also wanted to just make you aware that the state has put out these postcards, and with the intention that hospitals maybe start making the appointment. And this simply will, you might come across these given to some families that talks about making sure your baby is hungry when you come to the appointment, making sure your baby is tired. Don't let them sleep in the car the whole way here for the ABR and stuff like that. And questions, it has room for questions that you might want to ask an audiologist. And our goal is that hospitals do make that appointment. So I just wanted to make you aware that they're starting to use these postcards.
Okay.
And we also have this wonderful resource guide. And again, this goes to families who have had an official diagnosis. The state does send every family with an official diagnosis a copy of this
Okay.
resource
And I
guide.
know we have these.
And I'll leave you this one
Okay.
copy if you do feel you need more. And it just really gives the A to Z about hearing loss. So, and just different options that families may choose to go. I know when we were first diagnosed 5 years ago, there wasn't a whole lot, and you want to try to stay off the the internet. And then finally, again, this kind of repeats this family-to-family network. If you wouldn't mind hanging up our posters. And this is, again, connecting parents to parents. So just if a family is interested wants to have some answers or advice or has any questions, we just offer support to each other. And I've met some amazing families along the way. So, and then I will just leave you with this promising practices for audiologists to reduce loss to follow-up. And that's really our main goal, is we want to reduce that loss to follow-up and get those parents, we don't want to alarm parents that there's a major issue, but make sure that they follow up and get their babies rescreened. And again, those 1, 3, 6 milestones: 1 month, we want to have the babies rescreened; 3 months, we want to have the official diagnosis; and 6 months, we want them rolled into early intervention, because we found that that's the best for childhood development. And I think that is all that I have. Do you have any questions for me? I will leave you with my card.
Wonderful.
And you can simply, if you want any more resources or have any questions, I'll probably reach out to you for those names of the audiologists.
Yeah, absolutely.
And I think that's all.
Great. Thank you.